Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the lower right 6, 7, and 8 for crack evaluation. Starting with the axial view or the top to bottom view. Here, you will be able to appreciate that we've got no crown, no cracks in the crown structure other than slight bit on the 8 and the mesial aspect. We're going to look for further cracks. Here we can see PDL widening on the mesial aspect of the 7. We can see PDL widening on the interdiagonal of the 6 and PDL widening on the distal aspect or buccal aspect of the 8. Now, considering all of these, let's go back, slightly zoom in further if we can, and then let's try to look for cracks on this view again. Again, nothing spectacular can be seen, but right here is where we can see something on the lower right 7. There we go. That's one, and then we'll mark the other part, which is right here. Now, considering these two cracks, let's move slightly down and see that this is where we can see a little bit of radiolucency associated with this area as well. So 7 definitely shows a bit sign of a radiolucency. Whenever we look at a crack, if it is associated with the radiolucency, only then we suspect that this crack is actually propagating. This is the lower right 8 sagittal view, lower right 7, sorry, sagittal view. We'll zoom in slightly, and now you can see that the 7 definitely shows PDL widening, as you can see right here on this aspect as well. And then we move on this, so we can't see any cracks on this aspect, but definitely can see PDL widening here. And then finally, we have the beautiful coronal view where we can see the true cross section. And on this view, you will be able to appreciate the PDL widening on the buccal side. You will be able to appreciate the PDL widening throughout. We're going to try to locate the crack somehow, but on this view, it's very highly unlikely. But we definitely do see a slight bit of a line here, which you can discern on right there. So we can safely assume that the lower left 7 shows signs of cracks, whereas the 6 and the 8 don't show any serious signs of cracks. Clinical correlation is advised.